Hello everyone, good afternoon. We are live in San Antonio, Texas with Dr. Barlow, also known as Dr. Rocket. And today we are doing Lipo 360. She's also doing some lipo to her inner thighs. We're doing some Renuvion. Renuvion is a very common add-on for our lipo patients. When you take out all that fat, the Renuvion helps tighten up the skin with the heating mechanism to make it, to bring the skin closer together so you don't have that loose skin. We do have some specials coming up on our Renuvion, so you guys stay tuned to our social media channels for that. And we have a, Jenna is saying hello, Dr. Barlow. He says hello. We are showing this on YouTube as well, so if you guys want to check out YouTube, check out our YouTube channel. You can go to the link in our bio where you can see the cameras flipped and see the patient having the work done instead of just my face or the doctor's face. You can actually see this procedure going on, which is pretty cool. Right now we're working on lipo on the back areas. Yes, he does. So we do virtual consultations. They're very common. Even when we have our local San Antonio people, we do virtual consultations. So in person and virtual, you're able to book either one. You can do that through the link in our bio. In the bottom left corner, you can do it there too. We are happy to help, absolutely. You guys feel free to drop any questions you have on here. We are happy to answer. Anything about financing or booking a consultation, post-op care, getting ready for surgery or pre-operative care. I have a double botched abdominoplasty. So you're looking to have a revision done then. She had a double botched tummy tuck. Assuming it was botched twice.
Redo lots of stuff.
Do what?
Redo lots of videos.
Yes, he does a lot of revisions. She said that she's told there's no skin left to use to reclose the reopened area. Definitely booking a virtual or coming in to see Dr. Barlow so he can take a look and give you his input and advice on that. Yeah, absolutely. Just let us know if you have any other questions. You can send us a message too, and I'll pass you on to our team to get your consult booked. We were listening to hair metal with Dr. Phillips, so this is a drastic difference.
Like 80s hair still?
The what?
Like 80s hair?
Yes. It was like Motley Crue and
Yeah.
who else was on there? Oh, what's the name? Yes, Guns N' Roses. That's the other one we were listening to, yeah. Thank you for the follow, Florida Beach Man. I'm glad to see it's not raining right now. It was supposed to, I think, right now. I think it's supposed to start raining again today after 1. Hopefully it stays that way. My whole property was flooded Monday and today. Yeah. Yep.
What's that?
Lord. I live in on Bulverde Spring Branch area, so it's floods so easily over there. So Bernie's, I don't know my directions very well. So like we're right here, Bernie's over here, and I'm right here. I'm like, I know how to drive to Bernie, but we're getting on the rain here? Oh. Yeah, I'll show you. My driveway was all flooded this morning. No, that was my driveway. Yeah. It's right next to my driveway, yeah. I was like, I'm gonna get a tube. You what?
Waterfront property?
Yeah,
That's
it's
someone right there.
correct. And then there were trees in the street. I know. And I guess, I don't know, my gate, I have a solar panel that operates my gate, you know, like that powers it. And my gate was open this morning, so I don't know if it turned off or what, but at least it wasn't stuck shut.
Yeah, I guess that'd be smart.
Mm-hmm.
Thank you.
Hi Maria, hi Heather. Liz, thank you guys for joining. Hi Abdul, how are you? We are doing a lipo 360 with lipo to her inner thighs, and we are adding on some Renuvion as well. I'm good, thank you. Yes, this is surgery happening right now. Yeah, it's kind of cool to watch it while it's happening. Thank you. I appreciate that. For those of you just joining us, we're live in San Antonio, Texas with Dr. Barlow, doing a lipo 360 with some lipo to her inner thighs as well. And we added on some Renuvion too, so she's doing Renuvion to tighten up that skin, that loose skin that you get from the fat being removed. Do we operate hip hip augmentations also.
What's the question?
Hip augmentations, like fat to the hips, or
Say hip?
hip augmentation?
Like a BBL that's...
Yeah, okay. To fill in the hip dips, or
Yeah.
yeah.
Do that all the time.
Never seen it worded like that, but yes.
That's just a subset of BBL.
Hi Kim, Norma, Linda, hello. Thank you guys for joining. Did you drive over here from Houston today? Yeah. Yeah.
Not super heavy, just enough to make a road full of water.
Mm-hmm. So the pricing can be different just depending on how much you're looking to have or what you're having done. The best way is to provide your email and phone number, and I can have our team talk to you about getting your consultation with Dr. Barlow, so he can give you a good idea, and then we also can talk to you about our pricing and financing options. So if you want to drop your email in here, since you're on YouTube, I can pass it on to our team. Hi Alexa, Luann, hello. Happy Wednesday. Okay, I don't know how to read this. One more question. Do you guys rehabilitate oral and maxillofacial region?
Do you do what to it?
It said, do you rehabilitate, especially after surgery, like a, what does this say? What is this word?
Hemimandibulectomy.
Hemimandibulectomy.
Typically, we don't do insurance, so typically it covers that kind of stuff. Is that fully reconstructed? Maybe like it was for cancer, or?
Was it from cancer, Abdul? We don't take insurance here, unfortunately, so we're just trying to get all the right answers from you so we can give you the right information. Yes, he said yes. Yeah, he said yes from cancer.
Assuming they have insurance, it should be
If you have insurance, you can have that hopefully covered, but unfortunately we don't take insurance here. But for the hip augmentation, that's not covered by insurance, so we can help with that.
Yeah, you're not done lots of facial recon over the years. Most people want your insurance to pay for it.
Yeah, absolutely.
Makes sense to me. Yeah, whoever recommended you like, you should be able to get them into their plastic surgeons who will do the recon.
They should be able to refer you to one. Yes, absolutely. They do a ton of surgeries here, just all elective surgeries.
Price reductions, if they want to go back from them.
How much they want to lose and what insurance is. I've had people with plans where it's an absolute carve out, so you can take out 10 pounds aside and you cover it. Just never know. That was even better. That comes with hard.
There you go.
What is that?
That's 800.
Hi there, yes, we are in San Antonio, Texas. We're in the Stone Oak area of San Antonio. So now you guys can see on YouTube, we went in with the vaser for the lipo, and now he's going back into the same incisions with the Renuvion, so you can tighten up all that.
Hey,
Thank you for the follow, Adrian. For those of you just joining us, we're live in San Antonio, Texas with Dr. Barlow doing a lipo 360. She's doing some additional lipo to her inner thighs. We're doing Renuvion, which if you're on YouTube, you can see Dr. Barlow is doing the Renuvion right now, using the Renuvion tool. And one of our other doctors, Dr. Jeneby, was just speaking at Apex, which is the company that makes Renuvion. We just speak at the Apex conference 2 weeks ago. Thank you for the lightning bolts. Hi, Country Life. No, I'm with the social media team. I'm with their marketing team here.
What's that?
I wish I was cool enough to be an anesthesiologist, but it's the marketing team. Yeah, so I was the anesthesiologist. I don't think it'd be a good idea for me to be on here monitoring the comments versus yeah, versus the vitals instead. Yeah. James Ellis from St. Charles, Missouri says, "Hello, Dr. Rocket. I hope you're doing well."
Very well. Hope you will too.
Having a blast.
I'm a happy class.
Oh, cool, Adrian. That's very cool. Yeah, we have a lot of those too. Of course, thank you for joining the live. You were over at Chrysalis earlier?
Yeah.
Yeah, Abby was
I
like,
thought that was you over here. See here, the other girl was the same from here up.
yeah, well, I think we have the same color eyes. Yeah, I think so.
Yeah.
She has better lashes than I do, but
Here's one of the baby.
yes.
Boy or girl?
A little boy. I'll show you a picture.
Yeah, of course.
Let me see if I won.
You made the mark?
I know. I know. I should have. I know so many marks in the room.
Because, you know, it's my kid.
Yeah. That's
You didn't want your husband to find out.
I know. Well, you guys look pretty different too, so I think it would have been pretty obvious.
The obvious no.
Let me find there was one the other day we took this. There it is.
Oh, look at him.
He's big.
Cute.
What's his name? His name's Kobe.
Oh my goodness.
Like Kobe. Kobe, like Kobe Bryant,
Oh,
but
Kobe.
but not Kobe Bryant, yeah.
I like it. Dad tall?
6 foot, but his dad, so he's passed away, but he's 6'5". So grandpa is 6'5".
Okay.
He's 6 foot. His aunt's 5'10", so we're thinking, yeah, he'll probably be pretty tall.
Yeah, yeah. You can get up there.
Yeah. My daughter is, she's 14, she's 5'7". Yeah. So we'll see. She's taller than me. He's a good baby though. He's sleeping through the night already. He'll be 10 weeks on Sunday, so he's 2.5 months.
This number 2 for you?
This is number 3.
3?
3 and done. Well, I thought I was 2 and done, but
Oops.
yeah. At least I have my boy now because I have the 2 girls, so 14, 8, and then him. So there was a pretty big gap, but
Dressing up like a dolly, huh?
yeah. But now he's starting to get into that where he smiles, like not just gas smiles, but reaction smiles, and it melts you because they have no teeth and they just smile at you, and
Yeah.
I'm like, you can have whatever you want, take all my money.
Don't worry, Mom, I will.
Yeah, exactly. I was like, just ask your sisters. My middle child is in competitive cheer, so she really knows how to take all my money.
Oh,
Yeah.
somebody just got, some teachers just got fired because of some discipline actions on the cheerleading squad. A couple
Lord.
of the cheerleaders were made to do burpees. Yeah, burpees and push-ups for poor conduct, and they ended up getting some kind of muscle disease.
It's called yep, that one.
Myelin.
Oh my gosh, I can't think of what it's called right now, but I know what you're talking about. It's when you overuse it and you get it, and then the lactic acid gets in your bloodstream or whatever. What's it called? Yes. I was CrossFit certified at one point. Yeah.
And the football team had it last year. Yeah.
The same place?
6 guys from the same high school football team, same as the cheerleaders.
Just stuff they threw out back in the day.
Yeah.
Is that normal?
Yeah, exactly. Yeah, I was.
We have spankers and belts too, so.
I know, right?
Times were different.
I'm just, what happened? Your good old fashioned spanking is what I'm.
I know. Bring out the paddle. No, I'm just kidding.
That was probably more embarrassing than actually
Well, when he said burpees and stuff at first, I was like, oh my gosh, people are too sensitive, and then they get rhabdo. I'm like, oh wait, that's a little too much. Okay.
Yeah.
Okay, I'm gonna go into the meeting with Dr. Jeneby, and then I'll come back because you guys are gonna flip and see if you guys are still operating.
Yeah, we have